Good afternoon, everybody. This is Congressman Mike Levin. I am coming to you from a chilly Washington, D.C., where I got in on Monday, and I'll be here until Friday. I wanted to thank the residents of the 49th District. Obviously, we had an election recently, and I was so incredibly grateful for the support that we received and extraordinarily honored to get to serve as your representative in the 117th Congress. We wanted to get right back to doing our virtual town halls, and I'm really grateful to our whole team, everybody that worked so hard these last 2 years. We're excited to continue that work during the 117th Congress, which begins in January. We've got a lot on our plate between now and the end of the year, so I'm so happy that you're here. And in particular, we've got a lot to discuss with regard to COVID-19, as has so often been the case with our town halls these past many months since the pandemic began. I want to thank Jeremy, who does a great job with the video conferencing for all of these events. As you probably know, we are seeing an alarming rise. And don't mind that, that's the buzzer for here in the House when votes are happening or when they're opening or closing the House. Right now, they're closing down the House. So you hear that, it kind of sounds like high school, but you'll have to take my word for it. But we're seeing an alarming rise in COVID-19 really throughout the country. And we have encouraging news on one hand that we're going to talk about with regard to potential vaccines, great announcements from Pfizer and Moderna, the rising number of cases and the rising number of deaths, I think, just reinforces how important it is that we continue to take this virus as seriously as we ever have. And we've got to take all the precautions that we know will keep each other safe, such as this really simple piece of cloth, wearing a mask. So simple, yet so important. And I just encourage everybody in the 49th, please wear your mask, try to avoid large gatherings. Obviously, Thanksgiving coming up. Thanksgiving will look different this year for a lot of us. But we are making such great progress on the vaccine front. We're getting very close. We're speaking with our guests, and we're talking about a light at the end of the tunnel. Let's sprint through this last leg of the race by doing our very best to keep each other safe. And I am very honored that I believe for the 8th time or 9th time, something like that, here to answer your questions is our friend, Dr. Andrea LaCroix. Dr. LaCroix is a distinguished professor and chief of epidemiology in the Department of Family Medicine and Public Health at UC San Diego. Go Tritons. And it's great to see you, Dr. LaCroix. Thank you as always for joining us.
Great to see you, and I'm twice as honored to be here. However many times you'll have me. Thank you.
Well, we're going to take you up on that because I suspect it's going to be a pretty busy next several months as we continue to deal with this pandemic. I want to share, as I often do during the town halls, the latest numbers that we're seeing locally and really across the nation. Of course, if you've been watching the news, you know that we just crossed a very tragic number of 250,000 lives lost as a result of COVID-19. And as we've said so often throughout these town halls, it's so much more than just a statistic. It's mothers and fathers, brothers and sisters, sons and daughters, husbands and wives, coworkers, friends, acquaintances. We're all deeply touched by this virus. And I just want to say again, Chrissy and I are prayerful for the families, for those impacted. And it's just a heartbreaking tragedy for our nation. We, of course, as I'm sure you know, have the most confirmed cases of any nation in the world. Now over 11 million, closer to 11,500,000 cases. And as I mentioned, over 250,000 deaths. California crossed the 1 million mark. We currently have 1,054,635 cases. Only Texas has more, and 18,359 deaths. New cases are surging. Over the last week, the state has averaged 9,076 new cases a day. That's just in California. That's a 105.9% increase from 2 weeks ago. And roughly 5.2% of tests this past week have come back positive. Hospitalizations are also increasing. There are now 4,118 patients in the state of California with a confirmed case that is 58% more than 2 weeks ago. San Diego County, we've confirmed 66,319 cases and 933 deaths. Orange County has confirmed 65,957 cases and 1,526 deaths. And as I'm sure you know, the governor back a number of months ago introduced the blueprint for a safer economy, which revised the criteria, created the tiered system of purple, red, orange, and yellow. And he did what we thought might happen, which is he used the emergency brake, as they are calling it, effectively putting most of our state's population in the purple zone. San Diego County was already there. Orange County was in the red, now is in the purple. And that is based on the rapid community spread that we're seeing. The tier 1 or purple is a step backwards. We don't want to stay there, but we're seeing, unfortunately, a step backwards really across the United States right now. As always, a list of what it means for businesses is available, and for activities, covid19.ca.gov. I thought I'd also mention over the last week, San Diego County has reported an average of 752 new cases a day. That's 111.3% increase from 2 weeks ago. There have been 2.6 deaths per day in San Diego County, and there are 345 hospitalizations in San Diego County. Orange County has averaged 446 new cases per day. That's a 92.5% increase from 2 weeks ago. There have been around 2 deaths per day, and there are 270 current hospitalizations. Again, I've said all along, the best way we can address the purple tier and try to get back to the red, the orange, the yellow, the simple steps: wear a mask, don't congregate in large groups if you don't have to, choose outdoor venues over indoor spaces, socially distance whenever you can, don't touch your face, wash your hands regularly, and stay home whenever you can. And this is not rocket science. By now, you all know what to do. It's a matter of whether we're going to do it to keep ourselves safe, to keep others safe. And I hope that we all can do it. I know we can. I'm going to continue to do whatever I can to help our district, to help our community and our country to get through both the public health crisis and the economic crisis that we are facing. And I continue to believe, as I have said repeatedly since March, that we cannot have a healthy economy unless we have healthy people. So we've got to do all we can to crush COVID-19. We shouldn't have to wait until January 20th for the new Biden-Harris administration. We should do it right away. And I have called and will continue to call on my colleagues, both Mitch McConnell in the Senate Republicans, and my colleagues in the House. Let's set politics aside. Let's do right by our constituents. We acknowledge the massive economic crisis and public health crisis that we are in the middle of. And let's do what the people demand. We need more relief, and we need it now. This is no time to waste, no time to delay, no time to distract, no time to deny. We've got to get this done, and we've got to get it done immediately for both the good of our health and the good of our economy. If you've been watching or if you've been following the news, you know that all the way back in May, so think of that, several months back, we passed the HEROES Act in the House. That was a $3+ trillion bill to deal with this crisis. That came after 4 other bills that we passed between the beginning of March and the end of April to address both the public health and the economic crises that we're facing. You probably know, if you've been reading, that we've had fits and starts in terms of negotiations with the Senate, in terms of negotiations with the administration. I wish I could tell you that there was positive momentum for Mitch McConnell. I wish I could tell you there was positive momentum from President Trump and from his team. But right now we're at an impasse, and it's not an impasse of our creation. We want to get something done, and we want to get it done right away. And I know that for a fact, and I've said it to anybody that will listen, because the consequences of inaction are simply unacceptable in our community and in communities across the country. So we're going to do everything we can. Well, we have tens of millions who are facing the economic consequences. Well, the numbers are raging out of control to get another relief bill across the finish line. And you have my steadfast commitment that I will work with anyone in good faith who's willing to work with me on that effort. So on that happy note, there is good news as well, particularly on the vaccine front. And here to talk about all that's happening, good, bad, and different, is our good friend, Dr. LaCroix. And with that, I'm going to turn it over to Dr. LaCroix for her opening remarks. Great to see you.
Great to see you, Congressman. I think the opening remarks that I would like to make today really concern a reason to be happy. We had two companies, Pfizer and Moderna, say that they will momentarily submit for emergency use authorization two mRNA vaccines that appear to be way more effective than we ever could have dreamed. Let me just say that Francis Collins, the head of the NIH today, spoke for all of us when he said how remarkable it is that these two vaccines and perhaps others behind them have so greatly exceeded any expectation, both in speed of testing and in how they appear to be both effective and safe. So one of the reasons that they were able to come to an answer more quickly, sadly, is that there's so many infections in the world right now that many more cases were accrued in the trials than they had thought possible, just because the disease is so rampant at the moment. So that's, you know, it's heartbreaking, but it is going to bring us a vaccine more quickly. I think seeing that light at the end of the tunnel, I'm hoping will be inspiration that will draw us together. The other thing that's happening at the same time, as you've noted, is a raging pandemic, particularly in the red portions of our country. So we're divided. As I've said before, there's been an epidemic of misinformation on social media and certain broadcast stations that have convinced Americans, some of us, that the COVID-19 virus is a hoax, that it's no worse than the flu, and that our personal freedoms as Americans override the importance of the public health measures that you've spoken about. The costs of that are now being measured in deaths around the country. And I don't know, as a public health scientist, how we can get from where we are to a more united country, but I know we need to go there. So I'm hoping that very soon there's enough agreement where you are, Congressman Levin, that the suffering of Americans across this country is great enough to put aside the partisan bickering that's been killing people literally, and start with some measures to get the virus back in the can. And there is a growing sentiment amongst the epidemiologists and infectious control scientists in the country that what may be needed, if you really want to slow the virus down quickly, given its rampant spread, is some period of quarantine like we did in the early part of the pandemic. Probably 3 weeks would greatly decrease the spread of the virus in the community. And then when we come out of that, there may be the possibility of vaccinating healthcare workers and our highest risk colleagues, our highest risk fellow Americans. So that's kind of what I want to open with. I think your responsibility in Congress and the Senate is so immense right now. I've never seen our country suffer the way that it is. And what I'm optimistic about is that maybe because the election is over, maybe because it's a full 2 years before we have to go through this partisanship again, this is an ideal time for us to put aside all of that and do what we need to do. And it would save tens of thousands of American lives. So whatever I can do to help you, I'm here to help you.
Well, you've done an extraordinary job helping our entire community in the past many months, just with the public health guidance and information, and just continuing to tell the truth, and the science and the facts behind this, they don't discriminate on the basis of one's political ideology, and we've got to treat this with the utmost seriousness, every single one of us. So I'm very grateful to you for all that you're doing. And again, just know that it is our absolute commitment. I can speak for myself and for all the colleagues that I have spoken with personally to get something done in the lame duck in the next 6 weeks here, really less than that now, because we're supposed to wrap up the work of the 116th Congress on December the 11th. And at that point, we are going to hopefully have a spending bill. That's the other thing I'll mention, is that we have to have a spending bill and some agreement between the House and Senate on the major budgetary priorities, or we'll have a government shutdown again. And that's the last thing we can afford in the middle of a pandemic, is a government shutdown on top of everything else. So we've got to get pandemic relief. We've got to do all we can to help people who are hurting. And we've got to make sure that the government is funded. That's the basics right now. And that's, I hope, will be something that the president, when he's not tweeting about the election, can just pause for a second and recognize that his legacy at this time of crisis, I think the final chapter, I hope, is a more positive one. And I hope that my colleagues across the aisle know that, and I've told them this, that we want to work with them in good faith to get this done. We may not agree on everything, but let's focus on the things that we can actually get done this year, and let's see what we can do. With that, we've got a ton of your questions. We're going to get through as many of them as we can, and I'm very grateful for our comms director, Eric, for compiling some great questions. We'll start out with Mary in Oceanside, who asked, what is the level of restrictions that we are now in San Diego County? What are the restrictions in that level? And also I want to thank Catherine DeGeller from my office too, because I know she worked on this as well in compiling these from our constituents. So Mary, as I mentioned in the introduction, San Diego County, like most of California, is in the purple tier. And what that means is basically restaurants, places of worships, gyms, fitness centers, movie theaters, museums, zoos, and aquariums have to stop indoor operations. Other essential businesses like grocery stores, pharmacies, banks, and gas stations are allowed to remain open with indoor operations, but have to take safety precautions as appropriate. Those restrictions remain in effect until we move back in San Diego County into the red tier. And you can find more information about what's open or not if you go, again, as I mentioned before, to the state's website, or you can go to San Diego County, one word, sanDiegoCounty.gov/coronavirus. And if you're in Orange County, same rules are going to apply because they're also in purple in Orange County. You go to ocgov.com. So here's one for you, doctor. This is from Paul in Del Mar. What is current scientific guidance on COVID-19 spread via contact, such as doorknobs, mail, packages, groceries, vegetables, or cooked food? If significant, how do we prevent spread? And I'll throw one other thing in, which is I heard not to worry about surfaces, but then I heard in cold weather, like we're starting to have colder weather. Here in DC, we have a lot colder weather, that maybe you do have to worry about surfaces. So I'd love your thoughts on that.
So I just want to emphasize that the bottom line message here is that as far as we know, the vast majority of transmission is person to person, breathing in the virus droplets that are being breathed out, sung out, yelled out, and then huffed out. That is how we're getting it. I think surfaces are always full of germs, and there may be the rare case of COVID that's coming from surfaces, but that's why it's so important not to touch your face and to wash your hands. So what we do in our family is, if we've been out and about in the grocery store, we're not out and about very much, I might add. I'm still in quarantine. But I don't pass down our chores to other people and put them at risk. I really think it's our responsibility to take care of our household, and that's what we do. So when we get in the car again, when we've been out, we use hand sanitizer. When we get home, the first thing we do is wash our hands. And that has, I think that's keeping a lot of people safe, just those two simple things. So I still don't think fomite transmission is a big thing. We may learn differently. There are germs on surfaces, and I'm sure we've all gotten colds from touching touching the escalator thing and not washing our hands before we touch our face. So you can protect yourself from dirty surfaces by using hand sanitizer and washing your hands as soon as possible, keeping your hands off your face. So I'm not too worried about that. One more thing I wanted to say about the purple tier, Congressman Levin, is that one thing that's different in this purple tier than in the last purple tier is that you can get a haircut. The barbershops and hair salons have been reclassified as essential businesses, and I believe you can even, I believe that the other salon services are also considered essential now. So that is going to be less of a hardship for people. I think purple tier isn't that, for me, it's not that much different than red tier because we don't go to bars and restaurants anyways, because I don't think it's safe. I don't think it's safe at 25% capacity to be in a closed-in restaurant when the virus is circulating at this level, which is why we went back to purple tier. So I hope that's a clear answer to both of those questions.
Well, it is, and I just put on hand sanitizer as you were saying that. So.
Good.
And I was able, the House Barbershop here in Capitol Hill, here in the House Office Building is open. It opened up again, and it was able to get a haircut. So that's obviously good for our local barbers and salons who were just so impacted by the first shutdown.
I actually helped them lobby to be classified essential. And I do want to say, though, when I get my haircut, which I'm doing Saturday, I wear a mask the whole time.
Yes,
whole time.
absolutely wore a mask the whole time. Absolutely.
So does my stylist, and so we don't see each other's face.
Yeah.
And
same with mine.
Yeah, I'm the only person there, so it's different, it's different than normal times.
Here's another one for you from Josh in Ladera Ranch, who asks, with the recent news about the progress Pfizer and Moderna have made on their vaccines, what kind of work, actually this looks like it might be for both of us, what kind of work is being done in Congress to both make sure a vaccine is safe and that it is provided quickly and effectively? Perhaps you want to talk about the public health aspects of how the vaccine trial goes, the phase 3, and what needs to happen, and what the CDC and others are doing. I can speak to some of what we've done in Congress after that. How about that?
Okay. So what I think is happening with the vaccine trials is really easy to understand. So each trial is a little bit of a different size. I think the Pfizer one was 40,000 people and the Moderna one was 30,000 people. But what they're really doing is just counting the infections. Half got saline injections, the other half got 2 doses of active vaccine, and they're just counting the number of COVID infections. What'll be critically important going forward is, so far today's good news was they have, for the 2 vaccines we've heard about this week, watched very carefully for side effects or adverse experiences. We don't want to get something worse than COVID by taking a vaccine. So critically important, the safety part of this, and they're paying very close attention to that. A third aspect to watch as we go forward will be how long does the immunity that's conferred by the vaccine last? And I'm sure these people are going to be staying in the trial, and we're going to be, we're going to see when the vaccine, or when the infection rate starts to go up in the active vaccine group. And that's how they'll know how often they need to revaccinate us. They'll also take blood and watch for the immunity markers that indicate continued immunity to the virus. And they'll also investigate the few people that got COVID in the active vaccine group and why that happened. It gives me great confidence in our scientific community in this country, which is really amongst the best in the world, that they're able to figure all these things out and do so quickly. So I hope that it inspires everyone listening today and all of the people you talk to that we have such good science coming out on these vaccines now, and that we've waited through this period to hear this news, and that it happened to be so good. I just want to emphasize again,
It's a huge deal.
it is a huge deal.
The flu shot is normally what, 40 to 60%?
Very ineffective, very ineffective. So the next challenge will be, how do we get the population fully vaccinated, or as fully vaccinated as possible, so that we
Yes.
can, that will truly extinguish the virus months earlier than we thought possible.
And that's where congressional action came in, where all the way back at the beginning of March, we passed $8 billion for the vaccine, which wound up being used to help seed a lot of the development and the mass production, the advanced mass production of vaccine. So the idea being you'd have multiple vaccine candidates being mass produced. Some would be more effective than others. And when you're ready with the emergency use authorization for the ones that are effective, you've already produced a significant number of doses of the vaccine. Now, each of the vaccines, I know the Moderna and Pfizer both require 2 shots rather than 1, spaced, I think, a couple weeks apart, if I heard that correctly. And they also require cold storage. In the case of the Pfizer vaccine, really cold storage, and the Moderna one still, quite below 0 temperatures. So the infrastructure to put all that in place via Operation Warp Speed was something that was very important to the Congress, and we actually put in a lot more money than the Trump administration asked for. If you go all the way back to the beginning of March, they wanted $1.5 or $1.25 billion in new money for the COVID-19 vaccine, and we upped that on a bipartisan basis to $8 billion. We now, in the HEROES Act, which we passed, again, all the way back in May, included another, I believe, $26 billion for further development and deployment of the vaccine. And it's so incredibly important that the vaccine is distributed equitably. In other words, we have to get it to our frontline communities first, to our hospitals, to our healthcare workers, to our other folks on the front lines of all of this as soon as we can. Hopefully, many of them by the end of the year. I saw that Moderna is and Pfizer both are targeting millions of doses in the United States as soon as we possibly can. But we also need to make sure that the distribution is equitable next year. And obviously, for us to get back to normal so that Thanksgiving 2021 looks like we're used to, not like Thanksgiving 2020, we're going to need to vaccinate scores of Americans all across this country. And the other thing that concerns me, doctor, that we're going to have to continue to work on is public education around the safety and efficacy of these vaccines. Because the data that I see still suggests that, 30, 40, 50% of American people are reticent to get the vaccine. And that's where we've got what you said before, a lot of disinformation, particularly on social media, where, people know that if they talk about, the vaccines in a negative way, particularly COVID vaccine, they're going to get, viewers, they're going to get people watching and paying attention, and they're unfortunately getting traction. And these platforms aren't doing enough to ensure that misinformation around the vaccines are being prevented. And so that's another thing that we're going to keep a close eye on in Congress. Here's another one from Kate in Oceanside. Kate says that she has tested positive for COVID. She says, my 2 kids and husband have tested negative for multiple tests. Is there anywhere in San Diego County that my family can get an antibody test for free or low cost? And Dr. LaCroix, you may have more information on this, but I know many are saying contact your healthcare provider first. And San Diego County coordinated sites only provide diagnostic testing, which reveals an active COVID-19 infection. They're not offering the antibody testing, but you can find a map of both the diagnostic and the antibody testing at covid19.ca.gov/get-tested. So if you go to the state's website, and while there aren't many options for free or low cost antibody testing, the San Diego Blood Bank is testing all blood donations that they receive for COVID antibodies, and you can access the results of that after your donation. And doctor, I don't know if you had more to add.
Just that the San Diego Health Department also has a good page of free testing sites. I don't know if they're probably not offering antibody testing. And keep in mind that the antibody tests vary widely in accuracy. And even if you test negative, it doesn't necessarily mean you don't have antibodies. We still don't have a fully approved antibody test on the market. And they are looking at new tests like T-cell tests. The antibodies fade after a few months as well. So we're going to be looking for a test that is much more sort of a permanent test, if I could use that word, that marks our long-term history with COVID inside our bodies. And then we're also going to be studying the long-term consequences of having had a COVID infection. So thank you for that information. I think if you want an antibody test, as you started this, we should end it. Talk to your healthcare provider. That's the first place to go.
Thank you so much for that. Claire in Carlsbad says, I have noticed more and more people wearing face shields without masks. The Costco warehouse in Carlsbad does not require employees or the public to wear masks, simply face shields. It is my understanding that face shields alone protect neither the wearer nor others nearby. Can you please comment?
Yes, I can. We've had many conversations about face shields. The fate of the face shield's been going up and down during this pandemic. I did buy some after answering some questions earlier several months ago. The prevailing opinion now is, and by the way, that's my Costco you're talking about. So I'm going to be going around and making sure that people are masking. The thinking is that if you really don't want to get infected, a face shield is not as good as a mask. They have done laboratory type studies that show that, you know, these shields are really meant for healthcare providers so that when people have respiratory procedures and sputum comes out of their orifices, that the healthcare providers protected from that. I was wearing them for a while and I've got a drawer of them. And if I were to fly on a plane, as I've told you, Mike, I would wear both a face shield and a mask. I would do both because I don't want that guy next to me breathing on my face. And I don't care what they say about the HEPA filters in the airplane. That's too close to have somebody's breath. And I want my whole face covered. But I would not wear a face shield alone. The consensus in the medical community is that you can wear a mask, you must wear a mask, you can wear a face shield in addition, but it's not the same because if you walk through a big cloud of viral particles, it can come up and into your face. Doesn't close off that avenue.
Thank you for that. Appreciate it very much. Brenda and Lloyd ask, what can we do to ensure that sober living and group homes are complying with the mask wearing and the current purple tier precautions? This isn't occurring in our son's sober living community, where 25 to 30 men from different houses are meeting for dinner without masking or wearing gloves for kitchen duty. We are concerned about this vulnerable population. Well, Brenda and Lloyd, thank you for bringing that to my attention. I'm concerned about that as well. And I'm really sorry to hear that your son and you, by extension, are dealing with that. It's just critical that people follow the guidelines regardless of where they're at. And that certainly would apply to the situation you're talking about. What I would recommend you do is if your son is in San Diego County or in Orange County, I would report it. I would have you or your son report it to the county, and I'll give you the numbers. San Diego County, 858-694-2900 to report a health order violation. Again, 858-694-2900. And in Orange County, you can report it at 714-433-6000. But I know my team is watching this, and hopefully we will get back to Brenda and Lloyd with those numbers so that they can report that as a violation. From Ann asks, where in North County can we get a free COVID test? Well, we can both answer this, doctor, but as I mentioned earlier in regard to the antibody testing question, San Diego County first says contact your healthcare provider. And then the second thing you should know is that health plans are required to cover COVID-19 at no cost to the patient. And then if you're unable to get tested for whatever reason through your healthcare provider, or you don't have a healthcare provider, or you're uninsured, you can schedule an appointment at one of the free testing sites in San Diego County, which you can find online. Again, the website, sandiegocounty.gov/coronavirus, or simply calling 211 to get a list of the free testing sites throughout San Diego County. Anything to add, doctor?
The main thing I would add about testing is it doesn't confer immunity. So if you're thinking about getting tested before you visit with your family for Thanksgiving or Christmas, remember that a person with an active infection on the first day they're infected has almost a 0 chance of testing positive, and yet they're shedding and spreading the virus. So you saw in the White House that daily testing did not protect all of those important people from getting COVID infections. The only thing that will protect you is social distancing, wearing a mask at the present time. So I just want to emphasize again that I don't get to visit with my children for Thanksgiving or Christmas this year. They won't have it, and I won't have it, because we don't want to hurt each other. We will visit with each other, virtually, and we will give each other love the best way we can over the Zoom. But we know that it's a short time before we'll be able to get together in a safe way. And I just encourage everyone to see how close you can come to celebrating the holidays as safely as possible.
Well, every year we take a trip to my wife's parents in Arizona, and we are not doing that this year. And obviously it's just a tough situation for so many. And I just think it's important. We're so close. We know these vaccines now we're seeing are significantly more effective than we thought, and we see they're going to be available for a large swath of people very soon. We've just got to get through this last piece of this very difficult race, and we can do it. We can do it.
One more thing to mention. The reason is that the infection rate in San Diego County went from 8 to 12 in like a week per 100,000. It went up by 50%. We're in, if you look at the third wave in our country, it's just straight out the roof. There are a lot of asymptomatic infected people around right now. So there really is nothing to do to keep yourself safe, but stay home.
What if I could, doctor? What if I could? But I'll be back on Friday, and then, we'll be back for trying to get this relief deal done before the end of the year. But we're doing everything we can to take precautions while we're here. The House attending physician keeps a close eye on everything going on, obviously.
I'm going to do an epidemiologic study of the House and the Senate and who got infected at the end of this.
Well, I'll tell you, we just have to be super safe. That's what we're trying to do. And as an example, this morning we had our House Democratic Caucus elections over Zoom. A couple days ago or yesterday, we were introduced to all of our new colleagues via Zoom. So this is really, really different than what we're used to. But moving forward, this is what we're going to be doing probably for the next year, or at least for the next several months. Yeah. Jeff in Orange County asked a question about hair salons. He says, I'm an owner of 4 Orange County hair salons, and during the last 2 shutdowns, we almost didn't make it. The salons are just now getting back to somewhat of a normal, but the looming questions by all my stylists, are we shutting down again? And if so, what does that mean for our business? So my question is, do you know if Orange County does go to the purple tier and get shut down again? Are hair salons on that list of being shut down as well? As Dr. LaCroix alluded to, and now we are, so the question must have been sent to us a few days ago, because we're now in the purple. And as Dr. LaCroix said correctly, hair salons were allowed or are allowed to remain open during this, so long as they take the precautions as recommended. Here's one for you, doctor. This is from Debbie in Ladera Ranch. Once someone has had coronavirus, they have antibodies that give them immunity against the virus for a certain amount of time. At this point, we're not certain how long that immunity may last. During this immunity period, is it safe to say this person cannot infect others?
Wish I knew the answer. I think it's pretty safe to say that, especially the first few months after they recover. But unfortunately, we just don't know when their immunity wanes. There's only been a very few people with documented second infections, but the pandemic's still pretty young in terms of time. So the infectious disease advice that I've read from across the country says that you can be pretty sure that if somebody's recovered from a diagnosed COVID infection, that they are unlikely to spread the virus for at least 4 or 5 months. And after that, not so sure.
Got it. And I just saw an article today, I think in the New York Times, regarding the length of immunity. And the belief is that the immunity may last a fairly long time. So I know there's
From
still
a
a lot.
vaccine or from being infected?
From being infected.
Okay.
But that's one study, and there's a lot of data and evidence yet to collect to have a really good understanding.
Did they estimate what long time meant?
Well, they said that the basic idea was that the amount of immunity that they saw over a few months indicated that it might really last quite a long time.
Okay.
So I guess the level of antibody in the system that they measured over time. But I'll send it to you offline.
Okay,
I will send it to you.
It sounds
will
like
send
one
it
of
to you.
those things where they're guessing how long it may last.
Could be.
At this point. Yeah.
Could
Okay.
be. Well, that's what we tried to do in Congress with the CARES Act, is guess how long it was going to last.
Yeah.
And we didn't guess correctly because a lot of the programs are running out.
Yeah.
So hopefully the scientists guess better than the members of Congress. I hope. Here's one for me. This is from Angela in Rancho Santa Fe, who says, I'm concerned about the economic cost on our country and small businesses. Why can't we take a more precise approach? For example, rather than requiring all restaurants or gyms to close indoor activities, why not just temporarily close just those who actually had outbreaks and have them go through a cleaning protocol? Why do all businesses have to be penalized due to this increased activity? Well, I think that state and local governments and federal governments through CDC and the coronavirus task force, they are making the best public health policy based on the data that they have available. And they're trying to take a balanced approach. You're obviously going to impact people's livelihoods, people's lives with these measures. And there is a difficult balancing act that public policymakers are trying to juggle. But I do think that the state's restrictive tier, when you talk about the rate of infection that we're seeing right now going up so precipitously, is, from a public health perspective, I think is the appropriate response. That being said, we know that the greatest risk of spreading and contracting the virus happens when we're indoors. And since we're seeing an alarming rise in cases, that's where, the public health community said it made sense to limit indoor activities. And again, the best thing we can do, as I mentioned time and again, is take the appropriate safety precautions, wear the mask, socially distance, do all the things that we've said ad nauseum. Dr. LaCroix.
I'm raising my hand because I got a story to tell you. You probably already heard about it, but the reason why it doesn't work to isolate the precautions is that people leave a venue and spread the virus. So asymptomatic people are in one place, they leave the venue. And the latest story, which got published in what we call an MMWR, a morbidity and mortality weekly report, which is something that the CDC puts out every week, published the story of a wedding reception in Maine. Did you see that, Congressman?
I did see that.
And so let me just describe very briefly, 55 people were at this wedding reception in a town in Maine that had reported 0 cases of COVID. They had 0 confirmed cases. 55 people came and celebrated together, mostly inside, mostly without masks. As a result of that wedding reception, there were 30 cases at the wedding that emerged. In the local community, there were 27 cases and 1 death. But even more amazing and tragic was in a correctional facility 200 miles away, there were 82 cases. And the most tragic, in a long-term care facility 100 miles away, there were 38 cases and 6 deaths. So the 7 deaths occurred among people that were not at the wedding reception. And in the long-term care facility, 6 deaths, 38 cases, 100 miles away. That's why it doesn't work to take an isolated approach to the opening of businesses.
Well, I certainly appreciate that illustration. And I agree with you. I think we've got to follow the science. We know what works, we know what doesn't. And we've got to trust our public health experts.
I wish it did work. It's a lovely idea, and I wish it did work.
Next question, Bob in Carlsbad. This is not an easy question either. Once we are economically through this pandemic, which could take years, how are we going to get out of this financial hole that we are in? Well, Bob, I am like so many of you watching and so many of my colleagues here, extremely concerned about our national debt, our deficit to GDP ratio, and just what a financial toll COVID-19 has taken. And we're not done yet. When you listen to Jerome Powell, the chairman of the Fed, or when you listen to some of the best economic analysis across the ideological spectrum, you hear very similar conclusions, which is that the cost of borrowing right now is very low. The cost of allowing this virus to run out of control and to take the economy down with it will have massive economic implications. And the best thing, the best of the bad options that we have is to do everything we can to crush COVID-19, to provide people with the economic wherewithal to make it through, businesses and people, so that they can follow the public health protocols until the vaccine becomes widely available. We also need to invest that money in the vaccine, as well as diagnostics, as well as the therapeutics. We've got to get the money for adequate PPE. We've got to do it all right away. And if we do those things, it will still have a massive impact on our economy, but it will be less catastrophic, particularly long-term. Because assuming we can get things back on track in 2021, then we can really invest in things that'll lead to significant long-term economic growth, like infrastructure, public works, other things that we know from the past will work. And we're also going to have a very serious discussion about our long-term obligations and our long-term spending and our long-term revenues. And so we're going to have that serious discussion. But first and foremost, we've got to crush this virus, because the consequences of the alternative are simply catastrophic and unacceptable. And it's not good. I wish I had an easy answer, but we've just got to crush this virus before we can get back on track. And that's, I think, what we're committed to doing, including many of my Republican colleagues will acknowledge that same thing. At least they have to me. Next up from Alex. This is for you, Doctor. My dad is supposed to be flying out from San Diego to Boston on Monday to spend Thanksgiving with me. Ooh, I don't know how this is going to go. We won't be going out a lot, and we will both get tested before his trip. Is it worth it? I don't want to endanger anyone or ignore the risks. Should we cancel the trip, or could it be safe with the right precautions?
So we've covered a lot of that territory today, and like so many things in life, it's not totally safe, and it's not possible to do anything that would make it totally safe. I think getting tested, both of you, before he comes is a good idea. Him wearing, Congressman Levin, you are a living example, thank God, that flying back and forth across the country can be done safely. I would wear a mask and I would wear a face shield if I had one, and I think you can easily get one. On that plane, I would not touch anything in the airport, try to stay away from people, and hope for the best. I mean, that's about what you can do. But there's nothing you can do that will reduce the risk to zero. And that's why the guidance to Americans in the whole country right now is to stay home.
Yeah.
I don't know how to say, we all have to make our individual decisions. But my family and I have made the decision not to travel till this is over. We don't want to have a tragedy in our family that we would never forgive ourselves for, but every family has to make their own decisions.
Well, I have lived what you just said, try to take every precaution and hope for the best. And, I'm knocking wood, I'm knocking on my desk here, but we have been able to, fly back and forth for the better part of a year. I give great credit to the folks at the airlines. Specifically, I fly on United Airlines, and they have a partnership with, I think we've mentioned this, with Clorox and the Cleveland Clinic. And they use that electrostatic sprayer and they spray the heck out of that plane before we get on. And in between every flight, they give us the sanitizing wipes before we get on, just in case we want an extra sanitizing wipe. And you just take the best precautions that you can. And try to stay safe and try to stay, away as best you can from others. But, it's not ideal. It's not ideal. We do the best we can. This is from AH in San Clemente, also for you, doctor. They ask, given that it will be likely many months before a significant share of the population receives one of the emerging COVID-19 vaccines, how can we persuade anti-maskers, this is now a thing, anti-maskers to mask up, maintain physical distancing, and avoid large gatherings? And I feel like we've been asking this same question for 6 months. So what are your latest and greatest thoughts?
We somehow have to inspire each other that, that it's worth it to protect each other. I think the biggest arguments against doing it is this false dichotomy between American freedom and public health measures to control the spread of the virus. I must say I don't understand that myself, because we do all kinds of things, because they reduce risk of disease. We have a system that that inspects our food supply so that people don't die of food poisoning. We have rules about how auto manufacturers build cars so that we don't die in car accidents. We have all kinds of useful rules in our country that keep people from dying needlessly in our everyday life environment. And I view the wearing of a mask the same way. The first thing we can do is depoliticize the mask. It's not red and it's not blue, and come together as one country. And I'm just so hoping, like I said, I really appreciated your campaign, Congressman Levin, for its emphasis on bipartisan cooperation. It is so going to take that to undo the situation that we're in. You did it so beautifully in your first term, and I'm hoping you can carry that message out now.
We're going to work incredibly hard at it, and it's so important, probably now more than ever, that we try to unite after such a divisive election. In terms of the masks, all I will say is we've tried just about everything. We tried saying, wear a mask to take care of others. We said, wear a mask to take care of yourself. Both are true. Just wear it. Wear it to take care of your family, your friends, your coworkers, and yourself. There's really very little reason not to do it. And if you think about the 1,000 people a day or the 2,000 people a day that are dying, and the fact that a little piece of cloth could save perhaps 70, 80% of them based on everything that I've seen. Why wouldn't we do that? Why wouldn't we do that? It's just common sense. It's not, there's nothing political about a piece of cloth on your face. It's just common sense. And I'm grateful that, at least the president-elect, is definitely leading by example. I wish the president would have done the same and not, selectively worn the mask here and there, because it's just not led to good public health outcomes. People do ultimately take their lead from the President of the United States, unfortunately. And I have another question on that note. This is from Alex. What difficulties are we encountering as a result of the president's refusal to concede the election and allowing the free flow of information to Biden's transition team? Well, I think COVID-19 is a huge reason why we have to have a better transition between the Trump administration and the Biden administration. I think the vice president, or now the president-elect, said it well when he said that lives will be lost as a result of a poor transition. We know from the 9/11 Commission that as a result of the delayed transition between the Clinton and George W. Bush administrations, as a result of the Florida recount and the 36 days that went on until George W. Bush eventually won in 2000 in the Electoral College, we know that from recent reporting that we were a little less prepared, perhaps, leading up to the tragic events of 9/11 than we otherwise would have been. So we have a raging pandemic. That ought to be reason enough to have that transition occur. But it is astonishing to see so many of my colleagues defend the president's reckless and unfounded tweets and statements about things that are simply not true, which is, the reality of this is that one candidate won, one candidate lost. The American Democratic experiment resulted in record turnout, unbelievable turnout. And the election was fair. It wasn't perfect. No election is perfect. But by all accounts, it was about as good as we've had historically. And that was in the middle of a pandemic. And so all of those who worked so hard, who volunteered, who served to make sure the election was secure, I thank you. I thank you. And that certainly includes everyone in Southern California and San Diego and Orange counties, where we had amazing turnout, looking at 85, 86, 87% turnout in our district, which is heartening to me to see that overwhelming desire for people to make an impact and for people to make sure their voice was heard in this critical election. So the sooner we can have this transition happen, the better. We really need to put this behind us, and we need to move forward in a united way to address this virus right now, which is raging, spiraling out of control. Our last question is for you, Dr. LaCroix. This is from Josh in Carlsbad, who asks, I've heard that some people who got COVID will have long-term health consequences. Is that true? And if we've had COVID, is there any way to find out if we will suffer those same effects?
Good question. As an epidemiologist who focuses on older people, I think that is a critically important question. Grants have been awarded, at least a few, to start to investigate that. And the answer truly to your question is only time will tell. It looks like the cardiovascular and pulmonary system of some COVID survivors is damaged. And we're worried too about neurological effects, acceleration of cognitive decline and Alzheimer's disease, but we need more data to know if that has really occurred. We're also worried about the deprivation of the pandemic itself and how that has impacted people, both financially and socially and in other ways. It's been a very stressful period for America. And a recent study came out of Kaiser from the last 2016 election that showed the rate of heart attacks rose precipitously around the last election. And I'm sure that we'll find out the same things occurred in the experience that we just went through. Do we have to keep America this stressful? I mean, that is my question for the Congress and the Senate. Can you lower the level of stress for us a little bit in the future? And I think that's a bipartisan request. It's something we need to work towards, is greater peace. So that really speaks, I think, to this long-term effects thing. And I will tell you that we're committed in our health sciences system across this nation in learning about how this virus affected people of all ages across the life course. And there'll be a lot of studies on that. I'm hoping that most of them don't show anything. And I'm hoping that for the vast majority of people who survive a COVID infection, we find that they're healthy and they go on to live the life that they were in the process of living before the pandemic. I do have a friend, I shout out to my friend who just spent 10 days in the hospital. She herself is an infectious disease epidemiologist and has had a rough go of it. Her husband is an emergency room doctor who takes care of patients in Chula Vista with COVID infection. They're recuperating together in their house, but it's a long haul for them. They're in their 60s and it's been a tough experience. It's not been what you saw at Walter Reed. And it's not that experience for many people. So I have great compassion for everyone who has gotten this illness and who's recovered, and those who haven't, those who have family members who left us. Only time will tell the toll that this takes on us. And to some extent, to a very large extent, it's our behavior that's determining it today and every day. Everything you see in the data is determined by our behavior right now.
Wow. Well, I certainly hope that your friend and all those who are impacted are going to get well quickly. And we've had many of my colleagues now that have been impacted by this. And for some, they've recovered quickly. For others, they've been very, very sick. So obviously, Christy and I will continue to be thinking of and praying for everyone that is dealing with this crisis right now. We are just about out of time. I want to thank Dr. LaCroix again for just her wonderful presence with us, for sharing so much good information, and just for all that you do for our community. And I want to give you some time for your closing thoughts this week, and what a crazy time it's been.
Well, thank you for that. I think I've said most of what's on my mind today. I will let you know that I'm giving a talk tomorrow, a webinar on COVID-19 and vulnerable populations across the lifespan will take place at UCSD tomorrow. You can Google for that, or I can send the link and you can post it. It's open to the public. And there'll be many great speakers, much greater than I, talking at this, including Eric McDonald from the San Diego Health Department, who we all hold in very high esteem for all that he's done for our community to combat all manner of infectious diseases in San Diegans over the last many years. So that's a fun thing. I do want to just leave you, though, with the reminder that amazing news happened this week. We can see the light at the end of the tunnel. 2 vaccines are 95% effective and thus far have not shown any safety disbenefits. And we've already got a gazillion doses thanks to Congressman Levin and his colleagues who have planned ahead for this moment. We could never have anticipated news this good. So if we can just get the virus under control, by Christmas, and then distribute this vaccine, I think we can rebuild our economy. I think there'll be a whole new America in our future. We've learned how to do business a lot of different ways. They say the world will not go back to what it was. It'll go forward to what it can be. And I really am optimistic about that.
Well, with that, I'm so grateful again for all that you do. And we are, again, seeing that light at the end of the tunnel. And just stay safe, everyone, as best you can. We're almost through this. We've gone through an awful lot together. as a community these last several months, we can make it. We can make it to the end of this, and we'll be stronger as a result of our coming together in these final months before a vaccine is widely available and distributed. But I'm just very grateful, again, to you, Doctor. I want to thank my family, my wonderful wife, Chrissy, back at home, our children, Jonathan and Elizabeth, who have, all things considered, done an amazing job in a virtual learning environment for their third grade and their first grade. My hat's off also to their teachers, who have just been just wonderful through all of this. My parents and my in-laws, I love you all very much. And to my in-laws in Arizona, I'm sorry we won't be there face to face. We'll be seeing you just like this via Zoom, which is tough. But I can't stress this enough. We're almost to the end. Might be 3 to 6 months, hopefully less, until the vaccine is widely available, or multiple vaccines are widely available. In the meantime, please follow the public health precautions. Please, at this time, and do all you can to get your friends, neighbors, coworkers, colleagues to do the same. Follow the recommendations. Be safe. Keep each other safe. Wear a mask. Wash your hands. Clean surfaces. Use hand sanitizer. Do all the things we know to do, because they work. With that, I hope everybody has a safe and happy Thanksgiving. The virus is not taking a break for Thanksgiving, so neither should we. And I hope everybody has as good a day as possible. And we will see you very soon at our next town hall. Thanks again, everybody.